Over 110,000 people walk the streets of oil-rich Ghana, consisting of over 50,000 males and over 60,000 females who either cannot hear or speak. They are deaf. They vote, pay taxes, and perform all functions as citizens committed to building a better nation. They lead a life in which they have little say, though the 1992 Republican Constitution has enshrined their rights. The Disability Act was passed in 2006. Normally, when a bill is passed, a legislative instrument spelling out the full details or the benefits for the beneficiary is added. But in this case, 7 years after the bill was passed, proceedings has not ceased in Parliament. But the LI, which has become the hope of the deaf in this country, has not yet been passed. The plight of the deaf in society runs across the various facets of the economy, be it education, business, commerce, and health. In spite of the existence of laws that protect the rights of the deaf, the Commission of Human Rights and Administrative Justice, and the Disability Act, disabled persons are discriminated against every day. For them, having sign language interpreters facilitating communication between them and their abled counterparts would be a dream come true. This is Gifty, a deaf person whose late husband was also deaf. She is always saddened anytime she recalls that fateful night when her husband died as a result of the inability of doctors to communicate with a patient even at the point of emergency. When her husband's ailment became critical, the doctors could not understand the sign language she desperately made, pleading for the life of her benefactor to be saved. This is Evelyn, a deaf lady who goes just as any ordinary Ghanaian to seek healthcare at the hospital. She joins the queue like anyone else. Are there any effective measures in place to excuse any scenarios? She tries to get her hospital folder. Can you guess when the nurse routinely calls her name? So, can you now imagine how interesting the doctor's consulting room would be? How will they explain exactly what is wrong with them? It's Evelyn's turn. The doctor explains his experience.
The information I think I've just gotten about almost 40% of it. She's taking my energy, and I don't feel that I'm offering her the best because I've not gotten a definite grasp on the diagnosis that I was trying to drive at.
Recently, Ghanaians were crying foul over the absence of doctors and nurses at the government hospitals. But to the deaf, the doctor has never been at post. Some of these professionals who have sworn the Hippocratic Oath to protect lives of their patients discriminate against the deaf and dumb. Sambian is the president of the Association of the Deaf. He advocates a strong policy to help eliminate the barriers in the way of the disabled pursuing basic health care.
Unfortunately, we got a grant from START to be able to start a pilot project in 2 hospitals, namely Okovonochi Teaching Hospital in Kumasi and Woolwich Hospital here in Accra, to see how these 2 hospitals can bridge sign language services into the healthcare system as it stands. If this project, a pilot project, works out, then we can use that to replicate it throughout healthcare facilities.
So the academic curriculum of healthcare personnel is revised to incorporate sign language, and interpreters trained, the deaf and dumb would continue battling with their sentence to disability.